So, good morning, Senor Shamari.
Good morning, Sandy. How are you doing?
I'm good. I'm good. Let me turn on my secondary light. I've got like a key light over here that makes a huge difference.
Yeah.
Hold on a second. Lighting is everything. Lighting is everything. Yes.
My
So,
apologies. I see you had to, um, you know, you had to speak for a few moments. I had to run away.
no, no,
Had
no,
had
no,
a
no. That's okay.
had a little bit of a child belt emergency
Oh my
as
goodness.
as they needed to get through the door, so I had to
Yeah, no worries, no
go
worries.
help to figure that out.
Yes, and of course, I wanted our listeners to be aware that we do have some Cuban migrants who called me and said that they want to come on the show, and we, allow pretty much anybody who wants to have a say to come on the program. We're going to find out exactly what's going on with them after your segment. So
Awesome.
never a dull moment in the Cayman Islands, folks.
Yeah,
And of course, we like to keep everybody updated on precisely what's going on. So, listen, you have got 10 years now under your belt.
that's
Before we
right.
invite our guests on, can I ask you about the
Mhm.
building? Is it actually going to be larger than the one in East End?
So the interesting thing is, it's not as
Mhm.
large as the one in East End, but
Really?
because it's going up, it
Yes.
looks like it's larger.
Okay.
Whereas in East End, a lot of times when we would take pictures of the
Mhm.
building for our brochures and whatnot, it looks like a small building, and then when people actually come and tour, they're like, "Oh my
Yes.
goodness!" Because obviously it's a series of T's that have different
Yes.
blocks that go all the way back, so they're
Yeah.
very surprised by how large it is. And
Hmm.
this hospital, it isn't a small hospital, but definitely isn't as large a footprint, but
Hmm.
definitely based on going up a few stacks, it looks much larger. And we're
Yes.
excited, and that should be we should have our inauguration in July, and
Okay.
then it should be open in April. And the reason we typically do the inauguration before is so
Hmm.
that we can have 3 weeks or 4 weeks where we can give people tours to see the entire hospital. Because obviously,
Mm.
once it's open, once it's
Yes.
sterile on the inside, then that's it. You're not
Yeah.
going to have a lot of foot traffic coming through. So we want to
Right.
show all the equipment, want to show all the areas, want to make sure people have a good appreciation of what we have there.
Yeah.
Um,
Amazing.
and Sandy, just to mention, I have some good news and some bad news.
Oh,
Um,
okay.
so,
Well, let me think which one I want first. Give me the bad news first.
all right. So the bad news is that the Lakers lost last night. So
Ah, so
we're
that's it.
we're no
We're done.
longer there. We're
Oh,
done. We lost 4-1 to Denver. So
wow.
I mean, I think they're going to repeat again as champions.
Hmm.
There were a lot of close games. Lost 2 games in the last second, so you know how close it was. But so it goes. So that's the bad news, and the good news is we have reached the final stage of the semifinals in the over 40 basketball league that I play in. So next
Okay.
Saturday we win it and we go to the finals.
All right.
Um,
So
so
you're
the
still in
league
the runnings for that.
still running. So the league has been
Okay.
going a long time because they stretch it out. It's every Saturday to make sure that we have enough time to
To
recover.
recover. Absolutely.
Yeah. So
We have
so
an
that's the good
astute
news.
listener to the program. She's
Yes.
asking, did you mean August instead of April? Because you just said April.
Sorry. August.
So,
Yes.
yes.
So
Hmm.
it was an A. You see, I have my coffee here, and because I was doing the
Hmm.
belt emergency, I haven't had enough sips for the brain to fully wake up. But yes, definitely August. Sorry, a
Absolutely.
month
All right.
later, July, and then
And
definitely
then August.
August.
Well, thank
So
you. It shows our people are listening. They're paying
oh,
attention.
that's great. That's great. She probably is also listening intently to see if she can win that executive health check.
Hey, why
So
not?
make sure that everybody's listening to the program because they're going to be two, I think, two or three, I can't recall, that we have left that we'll definitely be giving away. But you have to listen in to make sure that you have the answers to the trivia questions that we will ask. And Sandy, 10-year anniversary, it's amazing that we're going to be able to actually speak more about it.
Hmm.
And the great thing about Health City, obviously, we had great buildings, great equipment. We continuously innovate with the type of equipment, but it's always about the physicians, it's always about the medical staff, and also the non-medical staff that we have that make Health City who we are. And at the end of the day, it's about those unique patients that no matter what walk of life you come from, we're always looking to give the best medical treatment possible. And we've saved many lives. We've helped,
Yeah.
increase the value of many lives. And on this show, we have two really special guests to us. One happens to be a staff member with Health City, and the other is a patient who is actually a doctor. I haven't spoken to him a while, so I'm not sure if he's still practicing, but he was when he was a patient of ours. And you'll get to hear about Dr. Leon Josephs, who is a medical doctor from the US and one of our patients that we would have had here, and one of Dr. Benoit's patients. So he's really near and dear and special and good friends of Dr. Benoit now. And we're very pleased that he made the time to be able to be on here to help us celebrate 10 years of being in the Cayman Islands.
Absolutely. Absolutely. And so we're going to go ahead and have, our guests come in now. So Dr. Leon Joseph, good morning to you, sir. How are you?
Good morning. I'm great. Thanks for having me.
Yes, absolutely. I think
okay for me to drink coffee too.
Absolutely.
This is the coffee clutch meeting.
Yeah.
I got nervous when I heard that thing about spilling tea because I'm much more of a coffee drinker than a tea. And just one editorial. I'm a lifelong Boston Celtics fan, and I am a little offended by you choosing the Denver Nuggets to be the champion. I think my Celtics are going to give them a pretty good run.
Well, you got to get past New York first.
I don't think much of that will be a problem.
There we go. You see, so
you Celtic thing.
You see, I have this. There is another patient who is a cruise ship patient, and he also is from the Boston area, who has been on the program before. Yes. And I'm also a Miami Dolphins fan. So I'm forever in games. Yeah. I'm used to having these fights, but at least in football, I think we're gonna have the upper hand for a while now. So get you back for all those years.
The beautiful thing is, Shamari always keeps us updated because, of course, we have no clue really about what's going on in the world of sports, and he keeps us updated at least with American football and basketball. So he's going to soon be our sports correspondent. I absolutely love it. So, Dr. Leon, we have a video here that we're going to play about your experience, and then we're going to have you discuss it. But it's so interesting to me that, in the past 10 years that Health City has been here in the Cayman Islands, they've had the opportunity to treat medical professionals, several physicians in a life and death situation. And I dare say that physicians have a very different perspective than maybe the average person when it comes to healthcare. And having, a testimonial from a physician firsthand, it's almost like you can't get any better than that, because physicians kind of look for different things than maybe the average person in terms of patient care and the quality of, the treatment that they receive. But let's go ahead and watch your video first, Dr. Leon, and then we're going to hear from you after this.
I came to the Cayman Islands because I'm on board of a healthcare captive. So I was here for those days to be at the healthcare board meetings. At the end of our board meeting, I went up to exercise on the treadmill, and I had a sudden death arrest, cardiac arrest while I was on the treadmill. And fortunately for me, I ended up at Health City.
In the ambulance we went after 3 defibrillations and a lot of CPR. And we actually went to another hospital first where they stabilized him, and then we were transported here to Health City. Kitano, he works in the gym at the Ritz, and he's the one who saw my husband collapse and started CPR right away. And if it wasn't for his quick thinking and fast action, we would have looked at a totally different situation here.
After 3 sets of CPR, I decided to use the AED. So, and I told my colleague that he can peel off the cover for the pads. At that same time, luckily, one of the guests was a cardiologist. He came and he introduced and said, I'm a cardiologist, and he took over the AED from my colleague and he pasted. And after that, we gave him like 2 shocks from the AED, and simultaneously he and myself did the CPR. Yeah, I am proud that I able to do something for our guests.
And met Dr. Benoit and Dr. Ravi, and they explained the situation to me. And it was because of them I decided that I would stay here and have Leon receive his care here. Because they just made me very comfortable with what they had to offer, and I really had a lot of trust in them because of the way that they treated me.
Dr. Benoit is a special guy.
Absolutely.
And
He's going to be our lifelong friend.
I suppose, yeah.
Yeah.
I'm trying not to get emotional, but he has a gift that most people don't have. And there's his technical part, which is very gifted. But as a human being, he was great with her.
And the kids.
And sometimes that counts more.
So when he came here, he was on ventilator. His blood pressure was borderline. He was totally unconscious, not responding to even painful stimuli also. And our senior cardiologist, Dr. Ravi Kishore, was here, and immediately within 30 minutes he was taken to cath lab, and emergency angiogram was done that showed very critical triple vessel disease. One of the arteries over the heart, that is called the left anterior descending artery, was totally occluded, and the other two, that one on the right side of the heart and one on the behind the heart, were very critically stenosed or blocked, like more than 95%.
Dr. Ravi is really good at, as well as explaining what he was doing. I mean, my kids understood what was going on. My wife understood what was going on.
One of the arteries called the LAD, the so-called widowmaker of the heart, was totally blocked. So in order to kind of give him some better circulation, we tried to open that widowmaker, the left anterior descending coronary artery. We successfully managed to perfuse it and produce some flow. Once we established that, we had a team discussion, and we decided that the best option for him was to go for an urgent bypass surgery. Till that particular time, he was put on optimal medications to prevent further damage to the heart.
After he came to the ICU, within 2 hours he was extubated. That means he was taken out of the breathing machine, and his recovery was quite smooth and straightforward. Second day he was shifted out of the ICU to the ward, and the fourth day he got discharged from the hospital.
I couldn't have ever gotten anything more than I got. I'm amazingly pleased with my care. I'm a vascular surgeon at home, so I see plenty of patients after cardiac surgery, and my care, my recovery, in my opinion, was as good or better than anyone I've ever seen. I'm very impressed with this. In fact, our company will consider sending some of our patients here for their care, because the model here is a model that the United States healthcare system is striving to get to. Yeah, this actually was a beautiful recovery, because it was me and Judy and the 3 kids. And as the children had to go back to their jobs and their professions, it got down to just me and Judy again, which is how it started. So
Yes,
we've had one long honeymoon,
we
right?
did, absolutely. I said, he really is my Christmas miracle. Don't cry.
All right, folks. Really such an amazing testimony there, Dr. Leon. I see that, you get a little bit, emotional about that situation. So can you give us a few details? When did this actually happen?
Sure. This was December 1st of 2015.
Wow.
So our company has a malpractice captive. So we go to the insurance meetings on Cayman every year.
Mm-hmm.
And in fact, the year before this, Dr. Shetty and Gene Thompson, and I know that Gene has passed away, I hope he's resting peacefully, gave a presentation at the captive meeting about Health City. So me and most of the people in the organization I was running at the time were very well aware of Health City being up and running on the island at the time.
Mm-hmm. So you come an island you actually here for that meeting?
Yep.
Okay, so you came for a business meeting, and can you walk us through kind of how you knew that you were in trouble?
Sure, that'll be easy because I had no idea I was in trouble, honestly.
Oh.
That was a Wednesday.
Mhm.
I was in meetings all day. I
Mhm.
met Judy at the beach for about an hour after the meetings. And
Mhm.
I said, I'm going to go up to the treadmill and work out before we go out to dinner.
Yes.
And that's the last memory I have until
Wow.
post-operative. So yeah, all of the decisions were made by Judy
Mm.
and a couple of physicians who were part of the group who were down there with
Mhm.
me for the meetings and who were well aware of what was going on at Health City. So I can't take any credit for the decision making to get me there.
Mhm.
That was all Judy and my colleagues and a really intense ambulance ride, I'm told.
Mm. Wow. So you wake up and you hear that you've had a cardiac event. What was the first thing that would have been going through your mind?
Well, first, I didn't believe it because
Yeah.
I was 58 years old in what I thought was the best shape of my life, worked out every day. Um, Took the only medicine I took was one aspirin a day,
Mhm.
which I just took because as a vascular surgeon, I thought it was the right thing to do.
Mhm.
So yeah, mostly I was in a state of disbelief and woke up and saw all of my children there, and they're adults. Judy
Mhm.
had them, fly in, one from Utah, one from Atlanta, one from New York,
Mhm.
to come down to Cayman. And I was like, what are all you people doing here?
Mhm. Mhm.
So that was really my first recollection of my medical event.
Wow. Just waking up and seeing your entire family there.
Yeah. But, Judy's a healthcare professional as well. She's a nurse practitioner, and
Mhm.
she made all the right calls. And we
Yeah.
had a friend who was ready to fly us to the Cleveland Clinic. They were going to send the Cleveland Clinic jet to Grand Cayman. And Judy said, no, we're going to stay here. And she made the right call.
Mhm. Mhm. Very good. So what were your thoughts as you started to comprehend what had actually happened to you and that you'd gone through this life-changing event? I see even this morning as you're rewatching the video, you're getting, again, very, very emotional about it. In that moment, do you recall what you were thinking?
I think the thing I remember most was Dr. Benoit.
Mhm.
And he's a technical genius, right? I don't think there's anything when it comes to a heart that man can't do
Mhm.
beautiful. But I really knew I was in the right place when I could talk to him
Mm.
because he's an incredible person.
Mhm.
Fantastic with the kids, fantastic with my wife,
Mhm.
and was able to talk to me as a patient and a colleague at the same time. And that's hard to do.
Mhm.
I've been trying to master that for 40 years of healthcare. He's got the magic. And
Yes.
I still, every December 1, I have a phone call with Dr. Benoit.
Mhm. Oh my
Because,
gosh.
the fact
Yeah.
is, it's whatever it is, 8 years later, I'm not here if he's not there.
Yeah. Amazing. Absolutely amazing.
And
Yes,
say,
Shamari.
Dr. Leon, Dr. Benoit apologizes because he was looking forward to coming on the program. But as you said, he knows everything heart related, and he had a little bit of an emergency that he had to run into. So doing what
He's
Dr. Benoit
in a
does.
more important place, I'm sure.
Yeah,
So that's where he is
yeah,
right
I'm
now.
sure
But
he's saving somebody's life. It's just amazing.
Yep.
and
Um,
and just to mention, Dr. Joseph, I just want to thank you for the testimonial that you gave,
mhm,
because you giving that testimonial would have helped to save numerous lives.
mhm,
And that's because when we first started, it would have been probably year 3,
mhm,
when that event happened. By you
mhm,
giving that testimonial, and us Caribbean people, when we go to different countries, even if another Caribbean national says it, at times they're still like, not so sure.
Sure.
But the US more or less is the gold standard that
Yeah.
we know on this side of the world. So hearing when I was able to play your testimonial and other testimonials, but specifically by you being a vascular surgeon and you being able to articulate the level of care and all of the unique factors with Health City, I know a lot of people said, you know what, let's give it a try, and started to send their patients to us. And so your testimony definitely would have helped Health City reach where we are today. So I thank you for being so open and so willing to share and to help Health City as well.
That was our pleasure. And as you can tell
Yeah.
from the video, that was speaking from the heart. Now,
Absolutely.
Definitely.
Yeah, absolutely.
Definitely.
you know,
So
I
many
look at
life
that as a marketing
changing.
piece. I looked at that as just being able to share a fantastic experience with others.
Definitely.
Yes. I mean, there have been so many people whose lives, and, they call into the program, they'll message into the program. Their lives have really been changed by, the team at Health City Cayman Islands. And it's just amazing, really. I mean, it touches us, I think, in a real way, because, you never know when you're going to have an event, a cardiac event, like what, you said you were healthy far as you knew, you were getting up, you were exercising, doing all the right things. And still, you just never know, a cardiac event can happen despite all of that. But to have life-saving healthcare services available in a place, especially like the Cayman Islands, I think is just absolutely amazing. It speaks to, just the development that we've had in the medical field over the past definitely 10 to 15 years, and it continues to be impactful. So when you started telling your friends, I'm sure the story started to get out, Dr. Leon, beyond your immediate family, and you said, hey, I've had this life-saving procedure in the Cayman Islands. Did you have any of them raising their eyebrow like, what, in the Cayman Islands?
Oh yeah, they were clearly. I mean, I trained in Boston, spent my professional career in and around Boston. And yeah, when I would tell that, they were like, well, you didn't get on a plane and go to the University of Miami. You didn't get on a plane and come back to Mass General Hospital or the Brigham or the Cleveland Clinic. And, those are decisions you have to make in the moment. And my response to them is, when you look at the care delivery model there, and you look at the volume of cardiac surgery that's done in India under the watchful eye of Dr. Shetty, it dwarfs the volume of cardiac surgery done in the United States, because cardiac disease is so endemic in India. So the system they have is efficient, it's perfected. So when they question that, it's really honestly out of ignorance. And once they become educated about the experience, they understand it.
Yeah. So they just don't know. And of course, you become a walking billboard for Health City Cayman Islands.
And, for me, it was, and for Judy, it was simple. If I'm going to become unstable, do I want to become unstable in front of experienced cardiac surgeons and cardiologists and their critical care team? Or do I want to become unstable 30,000 feet up in the air inside a hospital ambulance? And that's not where I want to be if I have a choice.
Yes, absolutely. And so 8 years later, how have you been doing? You look great.
I'm careful to say it because I thought it was perfect when this happened. But no, I'm great. I feel great. I exercise daily. I retired a year and a half ago, December of 22. Since that event, we've had 3 children get married. We've had 3 grandchildren come into the world.
Wow.
So yeah, life is really good. And maybe one of the most important things is we've had an opportunity to come back to Cayman and say thank you to Kitano and his team, and to go to the hospital and as a well, healthy, functioning human being, thank all the people who touch my care. And it's a legion, right? It's not, I mean, I love Dr. Benoit and Dr. Ravi, but without the nurses and the physical therapists and the dietary services and the rest of what goes on, I mean, that's a class A facility from top to bottom. The food is fantastic. And the healthcare, it was just phenomenal. And it's not because I was a vascular surgeon there.
Uh-huh.
I see them care for everybody in their outpatient clinics and then the inpatient setting there. It's a great place.
Mm-hmm. Wonderful. Well, Dr. Leon, will you hang tight? We're going to hear another story, another testimonial. Quite a few messages coming in this morning. So good morning to everyone joining the program.
Happy
Dawn,
to. I've got time. I'm retired.
Wonderful, wonderful. That must feel so awesome. So Dawn, again, remembering Gene Thompson, hoping that he's resting in peace. Vaya is sending greetings from Bolivia. So she says, hola, saludos y bendiciones desde Bolivia. So hi, greetings, and salutations and greetings from Bolivia. So Tanisha says, forever grateful to Dr. Benoit and the team at Health City. My mother, Joyce Pinder, is living her best life now. So another testimonial. Alv, we're going to have the Health City team reach out to you. Sounds like you might be having a little bit of a administrative issue going on, saying that there's Health City has no doubt saved many, many lives. I, for one, am truly grateful, and just having an issue with double billing insurance since December. So we'll have Shamari and his team reach out to the billing team, and I'm sure they'll be able to provide you with some further assistance there to see what is going on. So Grayson McLean is no stranger to most people here in the Cayman Islands, and Grayson himself, he actually works at Health City Cayman Islands, and he has had an amazing transformation as a result of the services that are available there, in particular the bariatric services. So let's have a look at Grayson's story.
I think more where it affected me was with my daughter coming home some days crying because she was being harassed at school about my size. When it started to affect my daughter, I realized as well, I won't be around for her if I didn't do something to better myself. This was me at 245 wearing a size 44 pants. This next picture was me at my biggest point, which is 355 pounds, and wearing a size 54 to 55 pants. And this is me in between, wearing a size 48 pants and weighing 275 pounds. It was hard sometimes when people walk up to me and would say, wow, you put on a lot of weight. I felt really hurt and distraught about that. But by that time, I think I was too far gone and needed more assistance than just tablets and diets to get me going. And I had tried everything possible to lose weight, diets, tablets, exercising. I just couldn't keep it off. It just kept coming back on. I feel like I've just been given a second chance in life. I feel finally I'm going to have that chance to walk down the aisle with my daughter. I've started back my softball. I do a little of the boxing in the gym. My self-confidence is much more stronger. I feel more prouder. I was able to finally achieve to do ballet dancing with my daughter at her school, even though she got a good laugh out of that. Anyone who's thinking about doing this, I would honestly tell you to definitely look into it and definitely give it a try. It is going to change your life in so many ways that you wouldn't even imagine. If you see me on the road, come feel free to ask me and I will tell you anything I can tell you about this.
All right, so Grayson, good morning. How are you?
Good morning. How are you all doing?
We're doing very, very well. Again, an amazing testimonial there. Let me just read a message that came in on WhatsApp from one of our listeners. So this person said, I know how the emotional part is because I had a similar situation with my then husband, emergency surgery, and HCCI was not an island. So we had to fly out, leaving 2 young children behind. And hearing Dr. Leon Joseph made me cry, just having to leave my children behind for those few weeks. Health City is a real good hospital, and I am happy for it. So again, someone who unfortunately, had their emergency before Health City was here, really the difficulties of not having certain types of care available in the Cayman Islands back then. So wow. Truly a testimonial again to being able to have these amazing services. So Grayson, you actually work for Health City Cayman Islands. Tell us a little bit about how long you've been there.
Um, since 2014, I started. Shamari brought me on to do all the transportation. And the funny part is, I do remember the doctor of transporting his wife up and down from the Ritz to Health City during the visitation, trying to see him and back and forth. So I do remember when he came in and everything else. So it's good to see you again and everything else, Doc.
It's good to see you. I'm glad you had great results.
Yeah. So, Grayson, we looked at your story caption there, and we see that you were struggling for many, many years with your weight. Did you notice it? Was there any particular time during your journey that you said, okay, you saw, like, was there a marked period when you saw it kind of really get out of control? Was it just gradual? Did it just kind of sneak up on you over the years?
I would say it started to sneak up, but then it increased rapidly in the end. I think that's where when Dr. Rang and them established that my metabolism had slowed down. And by it slowing down is where the increase of the weight came in. Working late nights, eating, not sleeping properly, these things, you don't realize it because so we're used to that kind of habit. You don't think it's a thing. And it does matter because you don't realize that eating late at night, you're not burning off that food when you're going to sleep. So it's just storing into fat. So working late nights, eating odd hours and things and what you eat definitely made a big difference.
And so you're working at Health City and you're seeing your weight continue to, be out of control. Did someone at Health City say to you, hey, why don't you consider the bariatric surgery, or did you really take it upon yourself to investigate that option more?
Actually, Dr. Ranger did approach me and asked me if I thought about it because he saw the difficulties I was having while walking down the hallway. I couldn't walk the full hallway without not breathing heavy and everything. So he asked me to come in and do a physical check, and I did this, and he saw some things, and he gave me that option, and I thought about it. And along with what was happening with my daughter coming in from school, I just said, you know what, time for me to give something new a try. And what better place to try it? I work with these guys. I see the work they've been doing. It was something for me to do. And I went ahead after speaking with a few colleagues and everything else. We went ahead and we did it. And something I would never change. I would do it all over again in a heartbeat.
Amazing, truly amazing. And it's so interesting. I'm glad that you shared, you've got the health components of obviously carrying too much weight and being obese. Everything from your blood pressure to your heart to all of your major organs are impacted by excessive weight, right? And poor diet and lack of being able to exercise and those sorts of things. But there's also an emotional component to it when you talk about the fact that, people would approach you and make comments about your weight that, made you feel really bad. And then those comments started to trickle down to your young daughter as well. People making fun of her because her father is overweight. So there's a real, sort of interpersonal relationships are impacted, how people view us in the community. I mean, I think that fat shaming is sort of the last accepted form of discrimination. We know not to discriminate against people for a lot of other reasons, culture, nationality, race, and whatever. But when someone is obese, so many people still, have snide comments to make. Caribbean people in particular, they'll walk right up to you and say some of the rudest things, even if you're not obese. Oh, you look like you put on a few pounds recently. What you've been doing. I mean, it's just absolutely crazy. The comments, even when you haven't gained weight, because sometimes I get it. I'm like, camera adds a little extra 10 pounds, but I know the scale hasn't moved. And people just make these comments. Like, I'm thinking, do you listen to yourself? Do you know how rude that sounds? But, sometimes I see other people on social media complaining about the exact same thing. Maybe they've just had a baby and people are like, oh, well, you're no longer skinny. I mean, they're just so blunt and rude with it, that it can have a really negative impact on your psyche. So you sound like you were very, very motivated to get this procedure done. Can you tell us a little bit about how you had to prepare for the procedure, both psychologically and some of the things that you had to do?
Well, once it was approved, I had to go through and see the psychiatrist to make sure mentally I was aware what I was about to go through, what was going to happen. Then again, I met with the nutritionists. The nutritionists then went through of what my food change would have to be, what I was going to be prepared for. And then before Dr. Ranger proceeded, he turned around and put me on a 2-week liquid diet, which was uh, let's just say not easy, but with the help of certain people at Health City, such as Lanny McLaughlin, Miss Grace Webb, and all of those, I had no choice. When I walked into Health City, what do you have in that cup? Water. Are you sure it's water? Yes, it's water. You can ask them to just sold me water. I walked in with a porridge. I thought that was liquid. Lanny grabbed it, chucked it in the garbage. That is not liquid. It is liquid. It's porridge. So I had my guardian angels over me, watching over me while we were going through.
Wow. She said,
But
not the
it
porridge.
was a task that I got mentally prepared for it.
Yeah. Oh, wow. Truly amazing. So we see some before and after photos of you. Tell us, how much weight have you actually lost?
Right now, I weighed last week, Friday, and I was 232 pounds.
Okay. And when did you have the procedure?
I had that done in 2017, November 9th.
All right. So that's coming into 8 years now, and you have managed to keep it off.
Yeah, I have done pretty well. Riding, I try to keep myself motivated, moving around, doing more exercise. It's more freer than it was before because I didn't have that energy. So by now, with this has helped in a lot of ways. So I've tend to do that, and then like I said, it gets you more motivated to want to do things. So you get more competitive with your bosses who tend to choose the wrong NFL team to root for, things like that. It makes you more self-motivated.
Absolutely. We have troublemaker Johan in class this morning. He says HCCI is one of the greatest assets to our country plus brand. Good morning, Samantha. Says truly appreciative to Dr. Benoit and his team. My son is doing great. He's 6 years old and doing great. Had open heart surgery at 7 months old. Wow. Last echo had a great result, and now attending a cardiac clinic every 2 years. Still hoping to return for an executive check sometime and to let the team see his development. Just need funds to do so. So Samantha, where are you from? It sounds like you're from overseas. Does this one ring a bell for you, Shamari? Do you know where Samantha is from? I know there's been so many that you muted yourself. Sorry.
Sorry, we've had so many pediatric cardiac cases. She would need to outline where she's from for me to know. I don't recall off the top of my head.
Samantha, let us know where you're messaging from. We'd like to know.
Definitely.
Of course, Johan is causing Trinidad and Tobago. Wow. Okay. Right here in the Caribbean. So
we've had pediatric cardiology cases from Trinidad and Tobago. Yes. Okay.
Yeah.
So we'll be in contact because we actually have reps in Trinidad, so we'll be able to definitely make contact through our international team and get her sorted. Definitely.
Okay.
And Sandy, just because we have Grace in here, obviously we have Dr. Leon here. Prior to responding to Grayson's comment, he has a disease that he cheers for the 49ers, so we'll leave it at that because they've lost in the Super Bowl a few times now in the last 10-15 years. But anyway, just wanted to mention that Health City, of course, came here, had a vision in regard to what we were going to do, to be able to be a test case to show that in a high cost jurisdiction, through the efficiencies and everything that Dr. Shetty was bringing to bear, that we would be able to offer life-saving surgeries at affordable costs. But just wanted to give some timelines in the first of what Health City has actually brought to the Cayman Islands. So in 2014, obviously we opened. We had the first cardiac bypass would have been in Cayman. We had the first LVAD ever in the Caribbean, and that's an artificial heart surgery that was done in 2014. In 2015, we got the gold seal of approval from JCI. So within a year being opening, that's a little bit of a record in and of itself. In 2016, we had the first TAVI operation in the English-speaking Caribbean, first renal denervation in the Caribbean, first stroke thrombosis in Cayman was in 2016. 2017, first ECMO patient ever in the Caribbean, first Caribbean pentalogy of Cantrell surgery. So that's the heart outside of the chest, the little child you would have seen in one of those videos that we had to put back in the chest. First awake craniotomy in the English-speaking Caribbean. So that's the brain awake surgery that we talk about when the patient was awake, that we were able to go in and have a brain surgery, and we'll discuss that further in another segment as well. First cryoablation in the Caribbean, 2017. First brain aneurysm clipping surgery in Cayman in 2017. First CCM device implantation in the Caribbean in 2017. In 2018, first brain aneurysm coiling in Cayman. Also in 2018, first arthroscopic lateral J surgery in the Caribbean, and that's an orthopedic procedure. 2020, we had COVID, and that obviously was a whirlwind. But then in 2021, we started our outreach into other portions of Cayman. So we opened our Cayman Brac Clinic in 2021, as well as the Camana Bay Clinic in 2021. Then in 2022, we had the groundbreaking of Health City in Camana Bay. We also had the opening of the Camana Bay Chemotherapy Center. And then we had the arrival of the robotic Da Vinci machine, one on island, in 2022. In 2023, we opened the Gene Thompson Radiotherapy Center, and that's the first radiotherapy center in the Cayman Islands. In 2023, voted Best Medical Facility in the Cayman Islands. 2023, Enterprise Accreditation from JCI. 2023, we had a collaboration with Dana-Farber Cancer Institute out of the US, and that's the medical institution that is aligned with Harvard. We have a collaboration with them. And in 2024, collaboration with Doctors Hospital, no affiliation in the Cayman Islands, but Doctor Hospital Bahamas, largest private medical facility there for all of their complex off-island care. And we are obviously in 2024 celebrating 10 years. And soon come, we will have the opening of our new Camana Bay facility right there in the center of Georgetown, coming in July, and fingers crossed will be open in August as well. So those are just, brief highlights of all of the firsts, all of the types of procedures, which are your higher level procedures that otherwise people would have had to have flown overseas for, or during sometimes based on time, may not have actually made it in time, or if they did make it in time to survive, the quality of outcomes would have been less based on the time that would have extended between getting an air ambulance. And you would have heard Dr. Leon speaking to the fact that, you don't want to be, 30,000 feet in the air when you have certain medical ailments. In a lot of cases, you would have to first wait many hours and then take that chance and be in the air to get to the US and or Jamaica or wherever else that prior to Health City, you would have had to travel to. So just wanted to make sure that listening audience understands in terms of all of the firsts and all of the types of procedures that Health City would have brought to the Caribbean as well as to the Cayman Islands.
Yeah, I mean, truly, truly amazing. I mean, when you go through that list, it's just like, wow, to think that all of that has been accomplished in the past, 10 years is just phenomenal. Dr. Leon, when you hear their list of accomplishments, what goes through your mind?
It's fascinating, right? For a hospital to open the doors to patient number one just 10 years ago and go through a list that has them at the cutting edge of medical technology and care in the entire world. There's nothing I can receive we now live in North Carolina. So if I were to go to Duke, there is nothing that can be offered at Duke that's not available at Health City. And that's just, amazing when you think that that's occurred in 10 years. And because I'm a surgeon, I tend to focus on the interventional parts of hospital care, but
yes,
this is duplicative, right? This is occurring in their chemotherapy units, in their radiotherapy units. This is outstanding inpatient and outpatient care from top to bottom. It's amazing that that's happened in 10 years. And I get it. It's not a completely de novo, right? It's based on an incredibly complex, mature healthcare system that has now adopted Cayman as a new location for the healthcare system. But it's still fascinating to me that it's occurred.
Wonderful. All right. So
at a cost, by the way, that is percentages of the same cost cares of an equivalent care episode in the United States.
And I think that's important, most certainly to note as well. So questions or comments, 936-2626. Obviously, the phone lines are open. Johan has a ridiculous request. He says, Auntie Sandy, ask them if we can get a 2-for-1 special for you and me, for me and you, sorry, so that we can get our hot bodies back, our hot summer bodies back. Johan, mine never left, so that will be your special only. He's Dr. Leon, I'm sure you're sitting here going, what on earth is going on this program? We have it's like a family atmosphere here. We have a classroom full of some very serious individuals and good students. However, Johan has taken on the role of the class clown. So he is constantly putting in these comments that just, make you just kind of laugh. Good morning to Fit Jamaican Girl joining us this morning. Garrett says people bring up the argument that the aircraft is pressurized, but to debunk that, the aircraft only gets pressurized between 6,000 to 8,000 feet because it is dangerous to carry surface pressure to 30,000 feet. So he's someone who has on his pilot hat this morning. Good morning to Fit Jamaican Girl. She says, I thought that was Paul Campbell. You mean Grayson joining us on the show? Oh. Okay. All right. So we do have some gift certificates we're going to be giving away this morning. Shamari, how many are we going to do?
I think we have two to give, and then I'll save one more for next week.
Okay. All right. Nice. Okay. So we do have questions. Shamari is going to have the questions ready for us. And of course, this is an executive. Tell people exactly what they're going to be receiving as part of this.
No, definitely. So you're going to get an executive health check. So, Dr. Leon talks about the fact that he was in top tip shape as he thought. And, we're always able to help you on the back end. But Health City always wants to make sure that everybody understands their numbers, that they go through the executive health check in order to, one, get advice if they need to change a few of their, daily living types of scenarios in order to make sure that they're as healthy as possible so that, with all given probability, they don't have to see a Dr. Benoit. So we're definitely giving away the executive health check that carries you through the full components. And I see Sandy showing, for those watching online, the bag that we would have, the canvas bag, as well as the Health City water bottle. And then obviously the gift certificate is what gets you the executive health check. So I made it purposeful when I went through all of our firsts. So for the first executive health check, if you can list at least 3 firsts that we've had in the Cayman Islands and or Caribbean, you will be a winner of an executive health check. So name 3 firsts.
Yes, 936-2626. You got to call in. Give us 3 firsts for Health City Cayman Islands. Good morning, caller.
Hi, morning.
Morning. Just speak up a little bit for me. You're live on air.
Hi. Okay.
Hi. 3 firsts.
Okay, for Health City.
Yes.
I know it opened in 2014.
I don't know if we're going to count that as a first, though. Are we counting that as a first, Shamari?
Well, let's see how it goes. Let's see how it goes.
All right.
Okay. And you had the cardiac bypass.
Yes.
Support, 2015.
Yes.
We 2015, you had some gold seal of approval. 2016, you had a stroke. A stroke.
Okay.
2017, echocardio patient. 2018, brain aneurysm.
All right. All right.
All
You've done enough. You've done
notes.
enough.
Taking notes. Well done. Well done.
She could give you a talk.
I know.
Okay, I tell you.
Absolutely. Absolutely. That
Was
is
listening.
fantastic.
Definitely. Ding, ding, ding.
Ding,
Executive
ding,
health.
ding. We've got a winner. Congratulations. Let me just get your first name.
Suzanne.
Suzanne, congratulations. And I'm just going to send your number this morning to the Health City Cayman Islands team, and they will contact you to get your little bag, your certificate included. Have you ever done an executive health check before?
No, I haven't.
Okay.
Making a lot of notes.
Yes. So this is a wonderful opportunity for you to get that done. Thank you so much.
Yes, thank you too.
Okay, darling. Wow, fantastic. We already have other people calling in, waiting for the next question. Or do you have a comment, caller? Good morning.
Yeah, good morning, Sandy. How are you?
Good morning, honey. I'm good. How are you?
Good morning, Mr. Scott. How are you?
I'm good. How are you?
Well, we're going to have problem, me and you, but do you know the second patient that Dr. Alvin did surgery on in the Cayman Islands?
Second patient he did surgery on. Was it you?
Exactly.
Ding, ding, ding. I'm a winner. What was it? Guessing that correctly.
Mr. Edward Solomon, God bless his soul that has passed away. Mr. Edward Solomon was the first one.
Wow.
Dr. Alvin did surgery on, and then I was the second one. And I promoted 30. Maybe Mr. Scott don't know, or I don't know if he was there then. I promoted 30 patients up there to Dr. Alvin and Dr. Benoit. I was the one also promoted on the Rooster and on Radio Cayman with Dr. Alvin for Health City. So I have a strong connection at Health City. From time it started, when it was open, I was one of the invitees to meet Dr. Shep as well.
Wow. Beautiful. Well, thank you so much for that testimonial.
Okay, Mr. Scott, I saw your dad the other day, and he told me that I mustn't call you, I have to text you for you to answer me.
Send me a WhatsApp.
Yes.
No, I don't have your number.
I'll send it to you. If you message me, I'll forward it to you. Just send me a WhatsApp and I'll give you his details. Not a problem.
Thank you.
All right, thank you so much. So yes, Mr. Shillette there sharing his story with us. So many testimonials, like you said. You know, it's amazing once you've had an experience like this, because you can't help. I'm sure Dr. Leon, even Grayson, can relate to this. You can't help but shout it from the rooftops. Like let everybody know that you've had this amazing, life-saving procedure at Cayman Islands, at a Cayman Islands hospital, namely Health City Cayman Islands. So thank you so much to that caller. Truly amazing. All right, our next question, Shamari.
I mean, the first caller did so well. That's why I wanted her to stop, because the next question is going to be named, because I went through quite a list, right? So name another 3 firsts that Health City has actually achieved. Let's see if somebody else was listening and writing it down, or I don't know if she did that from memory, but she did a great job.
Fantastic. So 936-2626. You can't name the same ones. All right. Good morning, caller.
Hello, good morning.
Good morning. How are you?
Yeah, let me try it. You did the first heart surgery where you put the thing outside of the heart. Your first
Sorry, I was just saying that you described that pretty well. So that was the thing outside of the heart. That's the LVAD surgery. Okay. Sorry, the second one.
Your first open your clinic came in back in 2021, and you
Okay.
did your first cardio oh Lord cardio bypass in 2017.
Did she list that one already?
That the bypass was
Do you have
listed
one
already.
more?
Do you have any more?
Oh, oh Lord, no, I don't have another one.
Well, you know what? We are in a generous mood, and the fact that you called in and you had first listed anyway, we will go ahead and give you that executive health check. Thank you for calling in, and thank you for listening.
Wonderful. Let me just get your name.
Georgette.
Miss Georgette. Hold on one second here. Let me make sure I get the number. Okay, I see you're calling us on WhatsApp. No problem. And Miss Georgette, have you ever had an executive health checkup before?
No.
Okay. So this will be your first time. Wonderful. Very good.
Yes, it will be. Thank you.
Yes.
I've always wanted to win, but I'm not always listening from the beginning, so I couldn't answer all the questions.
Yes. Well, you were on it. You were on it today. Congratulations.
Thank you.
I appreciate it. Thanks, my dear.
Okay, bye.
All right, we have another caller. Good morning, caller.
Good morning. How are you?
Not bad. How are you?
Not too bad. Did someone win it already?
Yes, we've had both Miss Georgette and Suzanne. Congratulations to both of them who were winners this morning.
Okay, so I don't have a chance then.
Next week. You
gotta be
yes,
quick on the numbers.
Yes, ma'am. Thank you very much, though.
All right, my darling. Congratulations.
All right. Bye-bye.
All righty. So yeah, you gotta be really quick. So this is fantastic. So Shamari, a lot of people are trying to win those gift certificates because this is an amazing opportunity for them to get a full executive health check and to really see their numbers. Dr. Leon, do you think, in your case, you say that there weren't any warning signs that you saw. Were you doing your executive health checks? I'm kind of curious to know if you were taking care of yourself.
Yeah, yes. So
okay,
annual, full, physical, all of my routine testing, lab work.
Wow, and it just happened.
There's just a percentage of people whose first cardiac event is a cardiac arrest.
Yeah,
we had one in the community living. We had a very fit guy who had just won his tennis championship have a cardiac arrest on a tennis court last week.
Oh my God.
So yeah, unfortunately it occurs, and you're only fortunate if you have people around you who know what to do from the minute you arrest.
Wow. Yeah. So, that's so important. And, Shamari, I think one of the episodes that I'd like to see us do hopefully soon is just talking about things like CPR and what are the devices called? Help me out here now.
The AED.
The AED devices, yes. And how important it is to have those available at different locations throughout the island. So really, really amazing. Thank you so much.
Katana, who's in that video, the reason I'm here and fine is the second I hit the deck on the back of that treadmill, his team was on top of me. And it's all about getting immediate restoration of blood circulation, mostly to your brain, right? From the CPR and then the AED when necessary. So, yeah, the fact that we shouldn't have a gym or a tennis court or a public place without an AED available. And more importantly, you need to have people who know how to use it.
You know how to use it. Absolutely. Yep. To get more and more people trained.
Yep.
For sure. Tanisha, joining us from the Bahamas this morning, is wondering if she can get the price for the executive checkup with insurance because she's going to be coming in to get this done. So tell her how to best contact you all because there's add-ons, Tanisha, that you can do. I mean, I have done the procedure and there's lots of add-ons that you can do, including the women's package option. You can do obviously cardio health. There's a couple add-ons that you can package together, so they can give you full details. Shamari, how can they reach out to the team at Health
Yeah,
City?
so she can reach out to info@healthcity.ky, or she can always call us if she wants to at 640-4040, area code 345 if she's calling from the Bahamas. But we also have a rep in the Bahamas, so if she wants to message you separately and leave her contact details, we can actually have our rep in the Bahamas reach out to her as well.
Yes. And Tanisha, if you want to, you can private message us here at CMR if you want to share your number. One of the Health City team members have said that they will have someone call you directly with more information. So just you can WhatsApp us 345-936-2626 or via Facebook or Instagram as well is the best way. All right, Angie says, I'm getting mine done soon. Go, Angie. We like to see people being much more proactive with their healthcare, and that's really what this is all about. Letting you guys know the amazing offerings that Health City Cayman Islands has available.
And I know she just said, Nurse Sands, and that's correct. That is the Health City rep. So she seems to know who to reach out to. Yes.
Okay, you guys got some feet on the ground all over the place. You know, Bahamas, TNT. This is fantastic news. So Shamari, I know you'll be back on the program next week as we continue to look at your expanding footprint for Health City Cayman Islands. Such a proud moment to be able to talk about all the amazing things, whether it's the Healthcare Explorers program, 40,000 plus quality interactions with students, that is, encouraging them to become healthcare professionals if that's exactly what they want to do. There's a young man in the lab, in the laboratory, very, very pleasant young man. He's kind of moved up. I can't remember what position he started in, but last time I was there, he was, I was being told by, what's his name?
Dr. Dhruva?
In the blood lab. Oh gosh, I can't remember his name now. But anyway, he was saying to me, this young man has progressed and he is doing so incredibly well, working with patients. And I think he may have recently got a promotion as well. So he's continuing talking about Caymanians. Daniel, yes, thank you. Talking about Caymanians who have really gone into Health City Cayman Islands and seen opportunities, not just to start within the organization, but to progress and have upward mobility and opportunities as well. So that's very, very refreshing. And one of the other physicians that I was speaking to recently was saying to me that, they're happy, like they come here and they want to see Caymanians who are interested, that they can then take under their wings and give amazing opportunities to, because he said, listen, this is your country. You guys have to, be willing to step up to the plate and take charge. So very, very good. Evelyn, your message has already been sent. She said, please remember to send my message to Shamari. Don't worry. I've already passed that along to him on WhatsApp, and he's going to no doubt get that sorted out for you. Fantastic. Anything else that we need to cover this morning before we?
No, I think I just want to say a huge thank you for, Grayson, who is in charge of our transportation. So he came in, helping us. He had his own company and helping us with transfers. And then we were so successful so quickly. We convinced him to come on board, and he has gone from being the owner driver to being the manager to having a slew of drivers, to also being in charge of other areas of deliveries within Health City. So we're very proud of Grayson and the fact that he's been with us virtually since day one. And then also thank Leon Joseph for always being so willing to share his story and to talk about Health City and his friendship now with Dr. Benoit. But you are special, Dr. Leon Joseph. But as you said, the great thing about Dr. Benoit is that he is like that with everybody. And that's that's some of the secret sauce, across with all of our physicians that come to Health City, that, back in tourism, we tried to bottle up what makes Cayman so special, and it's that Cayman kind. And, the Health City physicians and nurses and ICU team really fit within that Cayman kind that has helped Health City to be that extension of Cayman kind, not only internally, but also to the world as well.
All right, Miss Donna just wants a repeat of the phone number that she can call.
640-4040 or info@healthcity.ky.
All right, and Samantha is asking who's the rep in Trinidad and Tobago.
Yes, so that would be Aisha, but I can actually, if she wants a message as well, I'll send you all of the details for the rep in Trinidad as well. Aisha Munsami would be her name. And she actually grew up here in the Cayman Islands. Her parents were originally from Trinidad. She moved around a lot with policy and she's back in Trinidad, and she is one of our reps that we have in Trinidad as well.
Beautiful. Absolutely wonderful. So, Dr. Leon said in his case, he was doing all the right things and there were no warning signs. But I can tell you that for the vast majority of us, there are warning signs, folks. This is a testimonial, personal experience. You see your numbers going up, whether it's that A1C number, your blood pressure not being under control, your cholesterol, increasing over the years. You're putting on extra weight around the midsection, around those critical organs, including your heart. So there are normally signs that something is going to go awry with your health. And so pay attention to your bodies, do your executive health checks to give you some, even baseline markers of where you are and what areas you need to improve upon. I've told you guys already, I have myself a few numbers that I need to be very, very cognizant of. I need to do my best to bring those down. I need to exercise more. I need to watch my diet. Big shout out to, I told you guys recently, I did my colonoscopy and they found a couple polyps. And he said to me, we don't think that these are of any concern. I forget what the medical term are for these particular types, but they still send those off to biopsy. So this past week, I had my consultative call with the doctor there in relation to that as well. And he confirmed that, those are not the ones that they're worried about. So now I'm good for 10 years, unless something else happens that is kind of an indication that I need, to have that area explored. Good for 10 years. Once every 10 years, trust me, I know everybody talks about the prep being kind of and whatever, but it can be a life-saving procedure. And please, please, please keep in mind that, it is just one of those things that the numbers, especially in the US, are decreasing for people who are having colorectal cancer. Now they've recommended starting screening at age 45 instead of 50. So don't delay. We all know the things that we need to do. Make healthcare. We have an amazing facility here with Health City Cayman Islands. Make healthcare and doing your checks just routine. Part of the things that's on your checklist every single year that you've got to do. And you'd be surprised how you can catch things really, really early when you take that approach. Yeah. So that's my little spiel for today. All right. Wonderful. Thank you so much. Most times there are no prior signs. I think that there's signs. It's just that people don't always know, especially with young people. And Dr. Leon, you can speak to this because again, you're in the field. So you've done it for your entire professional career. People miss a lot of signs, don't they?
I think you said it well. Pay attention to your body. Right? People drive their vehicles and they notice that something doesn't sound right, and they take it right to the mechanic, but they don't listen to what their body's telling them. And I think you're spot on. When your body's telling you something, you have to pay attention.
Absolutely. Don't delay. All right, folks. So again, another segment with Health City. This is Medical Rundown Tuesdays with Health City. Thanks so much to Dr. Leon Joseph, now enjoying his retirement, grandbabies, weddings, all sorts of celebrations happening in his family, and still keeping an eye on what's going on with basketball so he can keep Shamari in check.
Exactly right.
we have half a championship up on you because I'm counting the in tournament championship.
And Mr. Grayson, thank you so much for sharing your journey with us, your weight loss journey. And of course, continue to keep on it, because I know so many people that have had the procedure and unfortunately, they kind of slide backwards with it, but you've been doing very, very well. So it's important to, again, do the things that you can do to control those elements of your health. So maybe I'll see you on the pickleball court one day soon, Grayson.
Hopefully, get Shamari there so we can make it a real competition.
There you go.
I don't know. Have you tried pickleball yet, Jamari? Have you tried?
I have not. I have not.
Oh
So
man, it's
we'll,
it's it's
we'll
awesome.
see. I was an avid squash player back in the day. So
Oh,
so
okay.
we'll see if those skills translate.
Yes, yes. All right. I'm gonna take up a little. We're gonna do a little challenge here. So yep, I'll send you some details. All right. Thank you guys so much. Really appreciate it.
Thank you.
Thank you. Have a good rest of
Thank
your
you
day.
for having me.
You too. All right, folks. So again, that is Health City Cayman Islands joining us for another amazing